Well, it is a topic that some women may be pretty timid to talk about, and our next guest is here with some advice and some treatment options. It's good to see you again, Dr. Schallen. And Dr. Schallen, you may remember her. She's been on here a couple of times before. She's the owner and medical director of the Center of Modern Aesthetic Medicine. Okay, this is something that's tough to talk about.
Sure.
Especially on camera.
Yeah.
But you have found that a lot of your patients are coming to you and kind of saying, hey, doc, you know, I've got this issue. I would like to see, could you do something about it? And there's been so many people coming to you about it that you now are pretty prominent in treating it. So what are we talking about?
Well, you know, we're talking about what laser can do off the face. So we know that it works really well to regenerate the tissue on the face for cosmetic reasons, for building collagen, for tightening the skin, for adding elasticity and allowing the skin to stretch and be more natural. But we can also use it off the body, and this treatment has been really revolutionary in the last few years. It's something that women are learning about more and more, and as they learn about it, everyone is so surprised to say, well, I have those symptoms too. I didn't know anybody else did. And we're talking about symptoms that are really related to after childbirth and the stretching of the birth canal, and then around the menopausal ages and beyond. So depending on which decade you're in, different symptoms. They could be leaking during exercise or coughing, so we call that stress urinary incontinence. And then with changes in hormones, we are talking about symptoms such as dryness, pain during intimacy, itching, those kinds of symptoms. And all of that, nobody thought, well, there's nothing you can do about that. You know, maybe we can do some Kegels, maybe we can, and that's all good. But it wasn't anything that anybody thought really had a solution.
And what is the name of this procedure so people can, you know, do some research on their own at home? And you also say this has been clinically studied.
Absolutely. The body literature is growing. Lots of research is being done. All of the research looks terrific. And more than anything, all the patients that come back to us, every single one of them have been helped. So it's really a gratifying procedure. If you were to look it up, you would look it up under something like women's intimate wellness or feminine rejuvenation.
Yeah, and those are, and let's talk
Right.
about like side effects or anything, and what you've noticed to your patients. How many times do you have to come and see you, that sort of thing.
Well, you know, we did some of the original studies about 4 years ago. We started them, and we were really surprised. We asked everybody to come back a week later after the very first treatment, and they all called and said, do we really have to come back? We're fine. So the side effects are really minimal. There's sometimes a little bit of itching, which is just your body healing, the wound healing response. Sometimes a little bit of swelling, but really no side effect. Pain is 0 to 1 on a scale of 10. It's a 5-minute procedure, and it's very, very effective. And women initially, when they come to us, may be a little bit nervous, and usually by the second treatment, they're laughing, they're texting, they're on the phone.
And many of them probably have no idea that this is out there, that this is available.
That's
Why
right.
do you think it's so important to get treatment for this?
Well, I think that some of it is prevention. We're still studying to what degree that we can prevent it, but prevent long-term needs for things like bladder surgery and slings. And so I think some of that is preventative. The other is really it restores people back to their previous lives, which really makes a difference in their personal lives. So I think that's important.
Yeah, and what would you say about discomfort, you know, for women who are a little bit nervous about doing the procedure?
It really isn't an uncomfortable procedure at all. It's like I said in the studies, women rated it as a 0 or 1 out of 10 on the pain scale. So
what is the conversation that women need to be having with you when they come in? Because it's one of those things where, you know, again, you don't really want to talk about it.
Sure.
A lot of girls don't even talk about it with their girlfriends or family members for that matter. I mean, not that they would want to talk about it with their family members. What do they need to be saying to you?
Well, you'd be surprised once they open up the conversation, how many women are interested in joining the conversation. So if they're having after childbirth or towards menopause symptoms of leaking urine when they exercise or cough or sneeze or just any of those symptoms at all, then they can bring that up. And also if they're having symptoms right around menopause of dryness or frequent infections, itching, discomfort. Yeah.
Okay, we got to go very quickly. Where are you located so people
We are in San Marco on South Side, located in the San Marco Place condominiums.
Good to see you again, Dr. Schallen. As always, we appreciate you being here. And we'd like to thank her so much for coming on, and Modern Aesthetic Medicine for sponsoring the segment. For more information, you can visit their website, which is cmamedicine.com. You can also call the office. Their number is area code 904-772-5828. Still to come on First Coast.